Welcome to Raaonline. Today's topic is seizure disorder in pregnancy. So when a patient with a known seizure disorder or epileptic patient becomes pregnant, how do we manage her? Now, these seizure disorders can happen in childbearing age group. So these women with epilepsy, the prevalence in pregnancy is around 0.5%, and we have to classify what kind of seizures they have. So you have to tell that whether they are partial seizures or generalized seizures in a pregnant individual. So partial seizures do not involve both hemispheres, whereas generalized seizures will involve both hemispheres. And partial seizures can be simple or complex, simple partial seizures or complex partial seizures. Similarly, generalized seizures are also of two types, that is absent variety, which is called as a petit mal, which is less than 20 seconds, or it can be a tonic-clonic type, which is called as grand mal epilepsy. So seizures are of two types, partial seizures and generalized seizures. Partial seizures do not involve both hemispheres, generalized seizures involve both hemispheres. Partial seizures are of two types, simple and complex, and generalized seizures are again of two types, that is absent variety when they are less than 20 seconds and grand mal variety or tonic-clonic variety when they are more than 20 seconds or they last for several minutes. Absent seizures are also called as petit mal seizures. Now, how does pregnancy affect the seizure disorders? So, in 75% of the women, there will be no change in this seizure pattern. 25% of women will experience that the seizure disorder has deteriorated or it has become worse. The more severe the seizure disorder, the more likely that it will worsen in pregnancy. So why does it happen? Because during pregnancy, the seizure medication clearance is increased because of the high hepatic microsomal activity resulting in low blood levels of anti-epileptic in a pregnant individual. So pregnancies sometimes need a dose increase or dose increment is required because of the hemodilution and